Okay, I believe all permissions for recording have been granted. If you requested permissions in the chat, you should now be able to record. If you still need permissions granted, please leave us another message in the chat. And Dr. Vanderhoff, we will now hand it over to you to begin today's press conference.
Well, good morning. I'm Dr. Bruce Vanderhoff, Director of the Ohio Department of Health. Before I get to our main topic, I want to briefly review where we stand with respiratory viruses here in Ohio. Thankfully, the trends that we discussed in our March press conference have all continued. Levels of COVID-19, influenza, and RSV are all still declining, which is typical as we get deeper into the spring season. Influenza activity, in particular, has declined rapidly. You may recall that as recently as early March, the CDC characterized flu activity in Ohio as very high. The most recent CDC data for the week ending April 13th now has our activity listed as minimal. This is welcome news, of course, but I do want to sound one note of caution, and that is that global measles outbreaks continue to lead to more cases of measles right here in the United States. So far this year, the CDC has reported 125 cases of measles in 17 states. That's more than double what was reported nationally in 2023. Of those 125 cases, 54% have required hospitalization. We've had 5 cases here in Ohio this year with 1 hospitalization. What these measles numbers highlight is the continued need for all of us to stay up to date on all of our vaccinations. The series of recommended childhood vaccinations, of course, includes measles, mumps, and rubella, or the MMR vaccine. Ohio's MMR vaccination rate among incoming kindergarten students was 89.3% in the 2022-23 school year, and that trails the CDC's estimated national average of 93.1%. This means a lot of people in Ohio are unnecessarily in danger of being infected by a disease which is preventable. 2 doses of the MMR vaccine have proven to be highly effective. So it is a highly reliable and a protective vaccine. Please protect yourself and your loved ones by staying up to date with the MMR vaccine and all of your vaccines. Give your provider's office a call to see if you or your loved ones are due for a checkup or vaccinations. Now, I want to turn to some concerning recent news reports that have highlighted an increase in colorectal cancer rates among younger people. When it comes to discussing cancer, younger people generally refers to those less than 55 years old. In both Ohio and nationally, we are seeing rising rates of colorectal cancer and, of even more concern, rising rates of deaths from colorectal cancer in this younger population. And what's particularly striking about this is that the increases are happening at a time when colorectal cancer rates overall, among those of all ages, are in fact dropping. According to the American Cancer Society, overall rates of colorectal cancers have dropped since about the mid-1980s. And the overall mortality rates have also dropped. Fewer Americans as a whole are being diagnosed with and dying from this cancer, and that's good news. The same is true in Ohio. The latest Ohio Department of Health report on cancer trends, published in January, shows overall declines in rates of colorectal cancers and deaths from colorectal cancers here in Ohio. It's important to point out that despite these declines, colorectal cancer is a serious threat to everyone. It's the second most common cause of cancer deaths in America. And estimates are that about 53,000 people nationally will die of these cancers in 2024. But the rates and deaths among younger people are what's drawing our attention. The American Cancer Society reports that among those 55 and younger, colorectal cancer rates have been increasing by 1 to 2% a year since about the mid-1990s. And deaths have risen about 1% per year since the mid-2000s. According to a study published in the Journal of the National Cancer Institute, millennials born around 1990 now have twice the risk of colon cancer compared with people born around the 1950s, while millennials' risk for rectal cancer is about 4 times higher than that of older age groups. Similarly, in Ohio, the first 2 decades of the 2000s saw colorectal cancer rates and mortality significantly increase in those less than 50, in both males and females. Now, why is this? Doctors have some ideas, and there's been some research into this as well. Family history can certainly be a risk factor, and there's research into environmental factors, such as exposure to certain chemicals. Others are looking at a possible link to how medications, such as antibiotics, can alter levels of the good and bad gut bacteria. But 2 factors have risen to the forefront of potential causes for this colorectal cancer increase among the young: diet and lifestyle. Recent generations eat more meat and processed food and consume more sugary drinks than earlier generations, while physical activity in this group has declined for decades. These are both factors known for increasing cancer risks overall. A new study out of Washington University School of Medicine in St. Louis looked at these factors in a different way, albeit not solely for colorectal cancers. They report that what they call accelerated aging, that is, when someone's biological age is greater than their chronological age, can increase the risk for cancer among those age 55 or younger. Researchers analyzed nearly 150,000 people and looked at biomarkers in their blood to estimate their biological age. Furthermore, the researchers found that individuals born in or after 1965 had a 17% higher likelihood of accelerated aging than individuals born between 1950 and 1954. And one of the major causes of accelerated aging, according to the study, is obesity. This is certainly not groundbreaking news. The medical community, and certainly many, if not most people, know that overweight is a condition that carries an increased risk of many chronic diseases, not just cancer. But to have a study tie obesity to accelerated aging and then find that those whose bodies basically are older than their actual age are at higher risk of developing early onset cancer seems to put more credence behind the push for us to improve our diets and our lifestyle choices. Now, I've talked about the importance of healthy eating and active living before, and this won't be the last time I bring it up. Certainly, when it comes to colorectal cancer, it is vitally important that we get screened at an appropriate age. The American Cancer Society recommends that anyone with an average risk for colorectal cancer should start getting screened at age 45. But to lower our cancer risk overall, we can take steps that will improve our diet and our physical activity. We can start small because we know that even small changes can lead to important health improvements. And now to help us discuss this further, I'd like to welcome our guest today, Dr. Rekha Chaudhary of UC Health and the University of Cincinnati College of Medicine. Dr. Chaudhary, welcome.
Thank you.
We've been discussing the statistics on rising rates of colorectal cancer among younger people and some studies about possible causes. As an oncologist, what are some of your thoughts on this?
I mean, anecdotally, we are seeing it. I'm a melanoma doctor, and we're seeing much higher rates of melanoma in younger patients, colorectal cancer, pancreatic cancer. Cancer is rising in younger patients, and it's disturbing, right? Because we don't often think of young patients having cancer as a problem in their lives.
Yeah. These studies that I referenced have hypothesized that lifestyle may be playing a meaningful role in some of these early onset cancers, including factors like diet and exercise, overweight.
Mm-hmm.
How important are those factors in your experience in cancer risk? And what are you perhaps seeing and communicating in your own practice?
Yeah. So integrative medicine is a field, as you know, UC is part of the OSHR, one of the 11 sites of the OSHR Center for Integrative Medicine, which means we collaborate with different areas like Harvard, Vanderbilt, all those kind of institutions working at this. So integrative medicine got the title, used to be called alternative medicine or holistic medicine. I think that's a very old title. And the reason they did integrative is we're going to first say, I believe in chemotherapy. I believe in immunotherapy. I believe in radiation surgery. I believe in surgery. So it's integrating lifestyle choices for prevention, as well as colonoscopies, as well as those kind of traditional medical approaches. Now, cardiologists have done a great job, right? I think every single person knows if I eat too much red meat, if I don't exercise, if I don't manage my stress, I'm at higher risk of having a heart attack, right? And I think that makes intuitive sense. I think, you can understand that. I'm eating this fatty food, it's going to clog up my arteries. Everybody knows that if they eat less sugar and they exercise, their diabetes will be better controlled. So endocrinology has done a fabulous job, right? In oncology, we haven't done as great a job, even though the data is there. And I think that it's not as intuitive to not just patients, but to other physicians as well, right? It's not intuitive that if I eat this high fiber diet, my cancer is going to be affected. So integrative oncology has really lagged behind. And I think the reason is people do these diet changes to help them tolerate the chemo better or feel better while they're getting the chemotherapy. But actually, there's a lot of data that shows benefit at not just a molecular level, looking underneath the microscope at the cells, the cancer cells dying, but at a DNA level, at a telomere level, at a genetic level, that it's actually changing the way your cancer cells are expressed. And I think that's becoming more prominent. And I think more people are talking about it. It's a complicated issue, right? It's not just obesity. It's not just diet. It's not just exercise. It's not just stress management. So when I talk to patients, I have 4 pillars that I talk about. And I talk about stress management, which has been shown in animal models to definitely, if we stress out these animals, their cancer and inject them with cancer, their cancer grows profoundly. Okay. We have looked at sleep. Sleep is obviously associated with, good sleep is obviously associated. And exercise and diet, exercise not controversial, but people don't think that that can affect their cancer. But there's actually a lot of studies looking at mice that have a wheel and mice that don't have a wheel. And the mice that have the wheel actually do much better from a cancer standpoint. Now, I would say diet is the most controversial area of integrative oncology. But one of the things that has really brought it to the scientific forefront is microbiome. So the microbiome is all the bacteria, fungi, and viruses that live in our body. We have about 40 trillion cells in our body and about 100 trillion microbiomes that live in our body. And, that makes sense that the colorectal cancer would be affected by that because that's where a great part of our microbiome is, our bacteria are. The microbiome are the quarterback of our immune system. A lot of people don't know that, right? What determines how our immune system reacts is a lot from the microbiome, okay? And so modulation of that microbiome is a very new and exciting area in integrative oncology. And there were actual studies published in Science in 2018 and 2021 where they looked at mice and they gave them stool from a patient's undergoing treatment for melanoma. and then they injected the mice with melanoma and then gave them some immunotherapy. And if you were a mouse and you got stool from a patient who wasn't responding, you didn't respond as a mouse. If you were a mouse and you got stool from a patient who was responding, your cancer responded. The only difference in the mice was the kind of stool they received. And that's published in obviously, as you know, Science is one of our premier scientific journals in the world. And then another group used the same model to look at fiber and to look at probiotics and look at different things in the mice. And what they found is that the diversity of the microbiome is the most important. Having a diverse microbiome. How do you get a diverse microbiome? Eating a high fiber, which the World Health Organization recommends 20 to 25 grams of fiber a day. The average American gets 15 grams of fiber a day. And if you've ever tried that, I don't know if you've ever tried to measure your fiber intake, Dr. Vanderhoff, but it is very difficult. 25 grams is a lot of fiber. It's a lot of fiber. But that is so important for the food for our bacteria, the good bacteria, to decrease the colorectal cancer risks, to decrease almost all cancer risks are associated with the microbiome.
Well, thank you so much. Very, very helpful, very enlightening, Dr. Chaudhry. Well, as I wrap up today, I want to highlight an important recent addition to the Ohio Department of Health's newborn screening program. Governor DeWine's office sent out a news release on Monday about this, but I thought it was worth celebrating it again today. The fact that Ohio has become the first state in the nation to begin screening all babies for Duchenne muscular dystrophy, also known as DMD. Each year, Duchenne muscular dystrophy is diagnosed in an estimated 20,000 people worldwide. It's characterized by progressive muscle degeneration and weakness. And while there is currently no cure, new treatments through gene therapy can help slow the progression of symptoms and improve the quality of life. And that's why newborn screening is so important. Our program now tests for more than 40 rare conditions. Each year, the screenings help improve the health outcomes of nearly 300 babies. And it's estimated that screening will identify 35 babies with DMD in Ohio each year. By catching conditions like Duchenne muscular dystrophy at birth, parents can immediately begin to find resources, support, and explore treatment options so that their children have a chance to live their best possible lives. Thank you. And Ken, I think we are ready to take questions.
Thank you, Dr. Vanderhoff. This may be a first, but we have no questions in the queue. So I guess I'll put out a little last call here. If anyone has any questions, please speak up now.
All right.
If we don't have any, I guess I'll just turn it back over to you, Dr. Vanderhoff, see if you have any concluding remarks.
Sure. Well, thank you so much. I want to again thank Dr. Chaudhry for joining us and sharing some of her experience and insights regarding cancers, and especially the new observations regarding colorectal cancer. And I appreciate everybody's attention today. Thank you very much.
All right, this will conclude today's press conference. Thank you for joining.